Hello, this is Dr. Do again. This video continuously from previous video in the series of systemic approach of medicine. Basically, this series of video laying out the structure and associated clinical presentations in terms of the from the invisible major compounds, their metabolism and associated diseases, move up to the cellular level and diseases occurring when the cells undergoing problems, and then move on to the tissue, which is invisible, and then on the organ system level, which are the really focusing, start from the skin, integumentary system as an organ, as a system, and also skeletal muscular system, like joint diseases or muscle diseases, and then talk about the respiratory system. Now currently it's on the cardiovascular system, and also cardiovascular system. I just bring the structures associated with the clinical presentations. Today I'm going to talk about the palpitation caused by the cardiac problems. I previously had another stream of video talk about palpitations, just broadly covered what are the causes, such as from metabolic diseases or endocrine system disease like hypothyroidism, or even the neurological panic attack, or any other psychological problem or neurological problem, and also could be normal, could be abnormal, even the dehydration, if it is severe, can also cause this palpitation, the sense of it. But today I'm going to talk about the palpitation which caused by the heart problem, heart diseases, which usually, if it is heart diseases, there's some exceptions, but the majority of the case, if it is the palpitation caused by the heart, need to be evaluated, need to be treated, unless it's paroxysmal, which means just the occasional episode, like paroxysmal supraventricular tachycardia, which could occur in your young or old normal people. But other than that, if you have long-going or persistent palpitations, regardless whether it is caused by the heart or whether caused by something else, but it's need to be evaluated, indicating something is going on, which really sometimes need to be treated. The sooner the better. So palpitation, the heart rate above 100 beats per minute. You can count in 15 seconds and times 4, or you can just count by 1 minute, or you can get the machine count for you your heart rate, what is it, and just the palpitation, feeling of palpitation, and the really objective how many beats per minute is also different. So if you feel your heart beats really fast, consistently, then you need to check to count it, give it exactly number. If it's really consistently long time, or like not going away, the heart rate above 100, you need to talk to your physician, regardless whether it's cardiac cause or some other causes. But so then just focus on the cardiac cause. What is the cause for this palpitation, increased heart rate? One I already mentioned, paroxysmal supraventricular tachycardia, which is usually it could occur in normal people, just the imbalance between the parasympathetic and sympathetic and autonomic nervous system. A previous video mentioned about it. So if that's the case, it will just go away. Or sometimes if social with activities or exercise, of course you know it, this kind of palpitation, tachycardia, really cannot indicating pathological cause, unless the palpitation or heart rate just cannot lower. For example, after you run, after you do really vigorous activities and your heart rate not tapering down to normal after hours, then that probably indicating something is going on. You need to see a physician. This is just an example. So this supraventricular tachycardia can be normal, can be junction rhythm, which is also pathological. Even though probably after you see your physician will say this is diagnosed as this or as that, couldn't find any conditions or any problems, but still they will give a medication to lower the heart rate, because the long-term palpitation or increased heart rate, tachycardia, is not good for the heart. Just increase the burden of the heart and then eventually going to the heart failure. So, and there are other causes, like particularly this group probably could occur in young people, but I'm talking about if you previously had other conditions or history of coronary artery disease or history of myocardial infarction or history of any heart disease or either rheumatic heart disease, valve disease, and you have the suddenly developed or gradually developed this palpitation or tachycardia, you need to see a physician, either regular or not regular, particularly if it is very fast, and just like it's like a shivering faster than 200 or 160, about 160 or about 200, and particularly if it is not regular, you need to see your physician to you know what I'm talking about. The condition problem is A-flutter or AFib. This A-flutter or AFib, like I said, occurring in those pre-existing other conditions, indicating the heart either conductive system had problem or previous history of ischemia or previous history of valve disease. So this is another group of causes of this tachycardia. And the other cause of tachycardia, I feel the palpitation is heart failure. Heart failure could be slow, could be fast, but usually it's actually a fast heartbeat, because the heart failure couldn't have the normal ejection fractions, which means the normal percentage blood has to be pumped out from the ventricles. If the number is lower than 40%, then the heart needs to work frequently in order to meet the requirement of body metabolism. So that is the feeling of tachycardia or the palpitation. So that if that's the case, it's also very urgent. You need to see a physician to evaluate your cardiac function. The ejection fraction, that's the medical term. It's measuring how much blood pumped through each heartbeat in terms of like either 80% or 90% or 40% or less than 40%. If it is less than 40%, that's really the number indicating for the heart failure. But this is going to be evaluated. So regardless, if you have this long-term going palpitations, not stopped, regardless what you do, you rest or you take your regular medication, but still there, you need to see your physician to evaluate. Your physician will listen to your heart, check your heart rate, and sometimes probably need to do the image, do the endocardiogram to evaluate the valve function and also the ejection fraction to see whether your heart really function at normal range. So I'm just going to stop here, and this is another video just focus on the cardiac cause of palpitation. What are the diseases you need to see a physician. So I'm going to stop here, and thank you for watching. I'll see you next time.